At CME Aged Care Navigators, we're obsessively committed to teaching people how to get the support they need as they age. Did you know we offer a 1-hour personalised consultation where you get to ask us any questions relating to your or your loved one's situation? You'll find a link to book a Let's Talk consult in the show notes and on our website. Welcome to your Aged Care Compass podcast. We help you make sense of the Australian aged care system by having conversations about topics you've asked us about. We're joined by thought leaders, professional experts, and people just like you and I who talk about their experience in the aged care sector. Hi listeners, and welcome to today's episode. I'm Michelle, your host. We've got a wonderful episode for you today, all about keeping your feet healthy as you age. My guest today is podiatrist Krissy McKenzie. Krissy is currently the senior podiatrist at Flexi Care, a home care provider in Brisbane South. She leads a team of 9 podiatrists who provide community podiatry services to over 1,500 clients across multiple funding streams, including the Commonwealth Home Support Program, CHSP, and the Support at Home program. Prior to working in home care, Krissy spent time working in private practice and residential aged care. Welcome, Krissy, and thank you for taking the time to chat with me today.
Thanks for having me, Michelle.
My pleasure. Krissy, what led you to train as a podiatrist?
Well, I always wanted to study something health-related, and I tried a couple of other areas before settling on podiatry. I think I liked the idea of working with athletes, but I started off in aged care and I haven't really left. So there are so many areas that podiatrists can specialise in, but I think that for me, aged care is really fulfilling because we can see what a difference we make to people's lives.
Absolutely. Yep. And I know when I think about podiatry, I usually think of feet, but podiatry is more than just feet, isn't it?
Yeah, it really is. There's so many chronic conditions that can impact our feet. So the most common one that I guess people think of is diabetes, but there are so many other systemic conditions like chronic kidney disease, heart disease, rheumatic and respiratory conditions that can all impact our feet and lower limbs. So while we very much focus on the feet and lower limbs when we're seeing clients, we do need to be aware of a person's overall health and medical history so that we can treat their presenting complaint properly.
Right, yep. So, Krissy, why is foot and lower limb health such a critical part of ageing well?
Well, Michelle, I guess mobility for anyone, young or old, is a critical component to ensuring a good quality of life. So poor foot health, whether it's through pain or deformity or injury, can impact mobility and I guess subsequently threaten a person's independence. And as we age, maintaining our independence in whatever capacity we can is very important. So ensuring our clients have good foot health can really impact that area of their lives as well.
For sure, yep. What are the most common foot issues you see in older clients?
Amongst our client population, pain is probably the number one complaint we see.
Okay.
Yeah, we tend to see fewer kind of textbook injuries and more issues relating to pain presenting in different ways. So very commonly we'll see things like ingrown toenails and foot deformity, corns and calluses, issues relating to arthritis and ulcers or wounds. So they're all things that we can treat and manage easily. It does help if clients are getting regular podiatric care because it helps us to manage them a little bit more appropriately. But management is often simple and can provide really, really beneficial relief to clients. So it's great that we can do that and make a difference to their lives.
Absolutely. And keeping it simple, as you said.
Yeah. Simple for us, but very beneficial for them.
Absolutely. Yep. So how do age-related changes affect our feet?
There are a few ways. As we age, our skin and nail integrity changes. So our skin thins, making us more susceptible to skin tears and subsequent infection. we're more likely to develop corns and callus beneath our feet, which can be very painful, and our nails will generally thicken. So it makes it more difficult for us to cut them ourselves and manage independently. We also undergo vascular changes, so a loss of elasticity and calcification within our arteries. So that can restrict blood flow to our feet, which can impact healing. And if we've got infection, it can mean that antibiotics are not getting down to our feet as well because the blood flow is not as good. Age-related muscle atrophy combined with the loss of competence in the valves in our veins, which assist the blood from moving back up the leg, can cause a lot of swelling and edema, particularly in our feet. So that can make fitting footwear difficult and sometimes can lead to ulcers on the lower leg. So there's a lot of small things that can have big impacts on our feet and lower limbs as we age.
There are. I'm just sitting here going, wow, there are so many things that can impact. Yeah. So what about chronic conditions? How do chronic conditions like diabetes or arthritis affect foot health?
Yeah, so as I mentioned earlier, there's so many conditions that can affect the health of our feet. Diabetes is very much a well-known risk. It is important to note, I guess, that many people can live with well-managed diabetes for years without any foot issues. So having diabetes does not automatically mean that you're going to have issues with your feet or foot health. They can be avoidable in many instances. However, if clients are not managing their diabetes well, and I guess that means things like eating well and managing their blood sugar levels, taking their medication correctly, it can lead to reduced blood flow and damaged nerves in their legs and feet. Because our feet are the furthest from our heart, they often show signs first. So when nerves are affected, we may lose some or all the sensation in our feet, which means we might not notice small cuts or sores, especially on the soles of our feet. And if they go unnoticed for days or weeks, they can get worse, become infected. Poor blood flow means that it's harder for them to heal and more difficult for antibiotics to reach the area. So that's why checking our feet every day is very important, and seeing a podiatrist regularly, particularly if clients have diabetes, can really make a difference.
Yep. And does foot health impact balance, mobility and fall risk in older people? And if so, how?
Yes, absolutely. So there's several ways in which poor foot health can increase the risk of falls. Pain is a big contributing factor. When we have pain in our feet, we tend to change the way that we walk to avoid the area. And sometimes clients won't even be aware that they're experiencing foot pain and will inadvertently start to walk in a different way. So they might have a corn or some callus beneath their feet, both of which can cause significant discomfort, but can also be removed painlessly during a routine podiatry visit. So it's an easy fix, but it's something that needs to be acknowledged by the patient initially, I guess. Also, pain from arthritis can lead to avoidance of doing certain activities, and that can result in muscle wastage. I guess the saying, you use it or lose it, is very true as we age. And sarcopenia, or age-related muscle loss, can very much contribute to an increased risk of falling. So maintaining both the small muscles in our feet as well as bigger muscles in our legs can help to decrease this risk.
Excellent. Community pharmacies keep Australia healthy. With 6,000 locations nationwide, they're open early, late and longer for convenient, accessible and safe care. Pharmacists provide home medicine reviews, dose administration aids and essential vaccinations. Thanks to additional training, many can now treat common conditions like ear infections, wounds and skin issues. They also support management of chronic conditions in partnership with your healthcare team. Ask your pharmacist how they can help you and your family stay well. And Krissy, are there early warning signs that someone's foot health might be declining?
Yeah, so often when we see a client for an initial visit, we'll complete a basic neurovascular assessment.
Mhm.
So this can identify the early stages of compromised blood flow or loss in sensation. We can also observe any early stage deformities and discuss early management strategies to prevent issues from getting worse. For example, bunions or the early signs of a fungal infection.
Mhm.
So it is always worth seeing a podiatrist, even if you think that there's not much going on. If you notice anything small or large, it's good to come and see us.
Yep, totally agree. And how important is footwear? And what should people look for in a good shoe as they age?
Footwear is so important at any age. Well-fitting shoes can reduce pain, reduce the risk of falling, increase walking speed and mobility and comfort. So
Mhm.
a good pair of shoes are very importantly, they're comfortable. So shoes should not need to be worn in. If we're looking for an ideal pair of shoes, they will have laces or Velcro, a
Yes.
wide forefoot or toe box, and a deep heel cup. So this should prevent the heel from slipping or coming out of the shoe.
Yep.
It should flex where the toes bend when we walk and not be able to, so should be unable to twist side to side. So different feet do require varying levels of arch support, but some support in shoes can help to stabilize the foot during that push-off phase of walking. So it's always good to consider whether a shoe is comfortable and feels supportive under your foot. But unfortunately, as you can imagine, a shoe like this is not always pretty, but it can
Yes.
make a big difference to people's lives.
Yes, comfort or appearance. What do we go for?
Right. That's right. And as soon as they get into a comfortable pair of shoes, they're very happy.
Yes.
They
Yes.
don't go back.
So true. What role can podiatrists play in helping older adults stay independent for longer?
I think that encouraging clients to see a podiatrist early and regularly can help to address any small issues that arise that they may not notice day to day. It means that there's someone else to address any changes that they notice, because often I think we don't see small changes in our day to day and therefore we don't address them. So I think regular podiatry care is very important for that,
Right.
in that way.
And when you say regular, how frequently would you be advising older people to see a podiatrist?
So it depends on the person and what they present with. Usually if we're seeing clients just for general nail care and they don't really have any other issues, we'll see them about 6 to 8 weekly.
Yep.
If they've got other issues, so they get ingrown toenails or they have a quick build-up of corns or callus, it may be even monthly that we're seeing them.
Okay.
So it really does depend on the person and the health of their feet.
Sure. Okay. Do people need a GP referral for a podiatrist or can they self-refer? And also, can a GP management plan be used for Medicare subsidised visits?
So a referral is not necessary to see a podiatrist. However, there are some subsidised options available. Most of the clients that we see at Flexi Care are seen under the Commonwealth Home Support Program.
Yes.
So this program is for clients aged 65 and over, and it is subsidised by the government. So they can have as many visits as they like throughout the year, and they just pay a small out-of-pocket fee.
Okay.
Most private podiatry clinics will accept GP management plans. These referrals are subsidised by Medicare and they allow clients to receive up to 5 visits across all allied health disciplines within a calendar year. But depending on the clinic, they may or may not have an out-of-pocket fee attached to the visit. I'm seeing more and more podiatrists not bulk billing these visits anymore, just because the rebate from Medicare has not increased in many years.
Yeah. There are costs.
Yes.
Exactly. Yeah. When should someone see a podiatrist and what can they expect from a typical appointment?
I think the best time to see a podiatrist is as soon as someone notices a problem with their feet, be it very small or large. Even if it's that they can't quite reach their feet to trim their toenails, that's a perfect time. So I would recommend not leaving it until it gets really bad, because it will take longer to treat. It's harder for us and harder for the client.
Yep.
So a typical visit will include going over a client's medical history, asking questions to understand their presenting complaint, what their issue is, and then creating a management plan with the client so that they're involved in their care going forward, and just ensuring that they're understanding and that they're comfortable with what we're proposing.
Sure. So what are some simple daily habits that older adults can adopt to maintain healthy feet?
The best thing people can do is a daily foot check. This can identify any issues that they may not feel. It can be a tricky thing if you can't quite get down to your feet, but there's some tips that we can use, such as a mirror on the floor can help to see the bottom of your feet if you can't quite reach down to grab them. And a habit that can prompt checking feet every day is washing and drying in between their toes. So if they're doing that routinely, then inadvertently they are looking at their feet. And in terms of getting down there to wash the feet, there are long-handled devices that we can get to help with that. So there's lots of tips and tricks that we use to help people to self-manage and ensure that they're able to check their feet and do the things that they can do independently.
Brilliant. What's one thing that you wish every older person or their family knew about foot health?
If you have a foot issue, please see a podiatrist. GPs are really good for many things, but they'll probably send you to see a podiatrist anyway.
Yep. So you're just going to shortcut. Yeah.
Yeah. So many clients come and see us and say, I've been to the GP so many times and it hasn't helped and they've sent me here. And I just say, oh, you should come to us first.
Yes. You're the experts. No, that's great. And very simple. I think people often think, I won't go to the podiatrist unless I've got a really bad foot problem. But it doesn't have to be that, does it? It can be simple maintenance, prevention. Yeah.
Yes. Some of the simplest things are the things that can make the biggest difference, I think. Even just trimming people's toenails, they seem so grateful because they cannot do it and they can't put their socks on, they're catching on their bed sheets. It's very uncomfortable for them. So it can just be something so simple.
Yep. That's what I'm getting, the recurring theme I'm getting from you today is simple things that make such a huge difference.
Yeah.
Oh, Krissy, a massive thank you for sharing your incredible knowledge and insight with us today. It's been a pleasure having you as my guest. Krissy, thank you. Really, really appreciate you being with us today.
No worries, Michelle. Thanks for your time.
Thanks for tuning in to another episode. Do you have a topic that you'd like us to cover on an episode? Please reach out and let us know via social media or our website, seemeacn.com.au. That's seemeacn.com.au. All the links are in the show notes. And don't forget to hit the follow or subscribe button so you don't miss any of our upcoming episodes.